All right. Well, hi. Can everyone hear me?
Yeah.
So it's just a quick introduction. My name is Michelle Rose. I work here at Norton Healthcare in Louisville, Kentucky, and I'm a manager of population health. I cover HIV, viral hepatitis, and STIs. I've spent most of my career in sub-Saharan Africa, moved to Kentucky on a whim, and cannot believe how rich in infection this place is. It's fantastic. And so so that's where I spend a lot of time also working with syringe service programs and really understanding the policy complications at the local, state, and national level. So I'd like to just do a quick round robin. I'm going to go to Barbara because she's right there. Barbara, could you do a quick introduction for us?
Sure. Hi, everybody. I'm Barbara Cave. I'm a nurse practitioner with PhD. I'm an assistant professor at University of Louisville School of Medicine and the Hep C program lead for U of L Hospital's Hep C Center. So a good mix of hepatitis C and HIV. And I like to really focus my attention on people who use drugs, especially young adults and pregnant women. And even though I like to screen, diagnose, treat, and cure, I also like to prevent. So my research surrounds prevention strategies.
And Joey, how about you? Let's go to you. And she popped up with your amazing red hair.
Thank you. Hi, I'm Joey Cantrell. I'm a public health nurse. I've been with the Wise County Health Department for a little over 30 years now, and I'm the lead nurse here with our comprehensive harm reduction program. We were actually the first in the state of Virginia.
Wonderful, wonderful. Brittany's next to me. So Brittany, you want to introduce yourself? Hey.
Hi, I'm Brittany Gross. Sorry, pardon me. I'm the Viral Hepatitis Services Program Manager here at the Indiana Department of Health.
We got a big job.
Yeah, so I actually oversee a small, but someday it's going to be big, linkage to care program.
Nice. And Imogene, I hope I got your name. Oh, I'm Emily. Sorry, now I can see. Would you go ahead and introduce yourself from your state? All right, let's go to Cameron.
Hi, folks. I'm Cameron Schatz. I work with the Pennsylvania Department of Health. I'm sure DOH was confusing for most of the people there at the end of my name, but Pennsylvania Department of Health. I am the prep coordinator for the Department of Health Division of HIV, work in the prevention section for them. For this job, I worked for a HIV provider. We did HIV and hepatitis C testing as well. So that's a little bit about the background.
Super. And to Emily's comment, I do not hear music playing in the background. Does anyone else? Okay. Let's see. Robin, do you want to introduce yourself?
Hello. Oh, hi. Hi, I'm Robin Lloyd Smith. I work for National Viral Hepatitis Roundtable. I am a person with a lived experience with hepatitis C and drug use. And I've been involved in advocacy since I was diagnosed with Hep C about, I don't know, 17, 18 years ago. I've been involved with advocacy, patient support, patient education. I ran Help for Hep, the peer counseling support line, for about 9 years, peer counselor and operations manager. And I'm now the community engagement coordinator for National Viral Hepatitis Roundtable. And I'm also on the board of the Virginia Harm Reduction Coalition. Helped start I was co-founder of Maryland Hepatitis Coalition, and am now co-founder of the newly organized Virginia Hepatitis Coalition. That
Nice.
just can give you an idea of some of the places I've been. I do some other stuff too that's related, but I'm really happy to see everyone, and this is awesome. I actually live in Southwestern Virginia, and definitely a significant portion of Southwestern Virginia as part of the Appalachian region.
Super. Hey, how about Gabby? Gabby, you want to introduce yourself? Let's see. All right, well, why don't we move over to Vanessa? don't know if she can hear us. Anyway,
Yeah,
Vanessa.
sorry.
Okay.
I am the HIV navigator with Norton Healthcare. I also work with HCV and HBV and also working with our PrEP navigation program and STI navigation program.
And in full disclosure, she's my HIV navigator. All right. Did anyone else not get a chance? Oh, we have Michelle. Michelle, do you want to introduce yourself?
Yeah, hi, my name is Michelle Bublitz. I'm a family nurse practitioner. I currently work here at Prisma Health and we run an MAT clinic here. We also treat hepatitis C also and do HIV PrEP.
Wonderful, wonderful. And Emily, do you want to do a quick introduction?
Hi, thank you for the fixing me out of the music. I was like, what's going on?
My pleasure.
Also, I did hear somebody about Redheads Unite. I'm Emily Argonata, and I'm located in Asheville, North Carolina. I am the Hep C Bridge Counselor for our region for Buncombe County specifically, and work with some of the other state bridge counselors. And so I basically link folks to providers, as well as assess them for any social determinants of health and assist with transportation, labs, et cetera, things like that.
Wow. Is there anyone we missed? And then we'll get into the meat of the conversation. I don't know if Jonathan got a chance to introduce himself. All right, well, here's Jonathan.
Did you want me to introduce myself?
Yes.
All right, I'm Jonathan Lewis. I'm a substance abuse counselor with the Louisville Health Department. I work in the syringe nurses program.
I know you.
Yep.
So to get into the meat of the substance, this session is on harm reduction for PWIDs and how to prevent infection. And not necessarily prevent infection, but to more effectively provide harm reduction services for people who use and inject drugs. And so I know all of us probably spend a lot of time thinking about that. And so I really appreciate the perspectives of the state, but I am open to, our goal for this is to, it's to come up with 3 key recommendations to promote, enhance, and improve outcomes for PWIDs. And so in our context, in the context of harm reduction. Does anyone want to start that conversation? I know it's different in every state, but okay, Barbara.
Yeah. So one of the things that as a clinician, one of the things that I've appreciated being hepatology trained. So I'm not public health necessarily. I'm not a primary care provider. I'm hepatology trained. And so, you know, I'm always thinking about liver and then secondarily the infectious diseases that can impact it. So that includes viral hepatitis. And like, eventually I realized like, oh, HIV is in that mix too, even though it's not exclusively a viral liver disease. But from a clinical perspective, how to integrate better care for people who use drugs or people who inject drugs in the context of harm reduction, we need to do more training for pre-exposure prophylaxis. That became abundantly clear. We had AASLD just this past week, and I did a little forum, had a half an hour an international audience, and it was very clear that the hepatologists were all kind of clueless on pre-exposure prophylaxis, but anybody that came from a different background, infectious disease, primary care, that happened to be in the liver meeting, they were like, oh yeah, this is easy. And that was my thing, like, oh yeah, this is easy. I wish I'd known sooner, but the hepatologists may need some hand holding in terms of they've got their HIV or their hepatitis C down pat and Hep B prevention, but HIV prevention needs to merge in there somewhere. We need more help and training on that.
I love that suggestion. Anyone else like to just kind of toss a few things out there? Anything you're thinking from your experiences? And oh, come on, don't be shy. Oh, good.
I'm sorry,
navigator.
can you repeat real quick? I apologize. My supervisor was DMing me and I missed it and I apologize.
Oh, that's okay. So the question is, from a harm reduction perspective, what can we do to improve, promote, or enhance outcomes for PWIDs in context of harm reduction? Anyone want to have a go at that?
Are you
Joey?
asking?
Yeah, so the conversation is like, as you as experts in this field thinking about like, how could we like for key recommendations as an outcome for this conversation, what can we recommend as people that work in this space to say, hey, I think that if we did this, we'll have significant improvement, or we'll have, you know, lower infection. And so like my thing is, I really promote smoking, and it's not only because your risk of infection in a viral bloodborne pathogen infection is so much lower. And so it is a safer alternative to injecting. And so when we have syringe service programs that don't offer alternatives, and they don't understand the difference between, like, it's like, yeah, it's bad for your lungs, but there's zero risk for HIV or HIV and HCV acquisition, at least through drug use, that it's a good alternative. And particularly when you start looking at heroin and inhalation. So like non-coated foils, that's would be my recommendation, is really promote alternative routes of administration. Anyone?
Well, yeah, I would say, you know, in my wheelhouse tends to be viral hepatitis, but some of the most significant improvements I could see is if we can do point of care, point of service testing, treatment initiation, and peer navigation.
I love it. And in doing that, would you want providers on site? So you want providers at like syringe service programs that can actually go ahead and do the testing, and particularly with Hep C, you know, the FDA hasn't approved the RNA point of care test. So I think a little advocacy there would be nice. They do it in Europe, you know, so.
Absolutely. Yes. And there are efforts to, you know, try to speed up approval of the platforms that can utilize a point of care testing. So any advocacy that can be done on that part, it would be invaluable. But it still can be accomplished, you know, and there are people that are doing providers that are able to do, put together programs that can provide point of care diagnosis and treatment initiation.
Here at our syringe services program, we do offer testing. We have the 1 minute HIV test. We also offer the rapid Hep C testing. And then we're fortunate because we do have providers here. I actually do the Hep C treatment program. So we are able to catch them early when they first come into our program. If they are negative, you know, it's teaching and trying to keep them that way. But those who are positive, we are able to go ahead and immediately refer them, since I do both programs, get them into hepatitis C treatment right away, and thus, you know, better outcomes for them and less spread to others.
So we typically see here with our Hep C clinic about a 50% no-show rate. Have you seen through your program a much lower no-show rate, or do you know that?
I actually have one of the best show rates for Hep C clinics in the state, but it's because of the relationship that I have with my clients. They'll tell you I'm very much a mother, and they know that I don't care one bit to peck on their door if they don't keep their appointments. So I'm generally calling them the day before and the day of, and I stress to them, you know, as much as I love you, you're going to be one and done. You don't show, you go to the bottom of the list. So tend to keep.
I think always the hallmark of great navigators is persistence, and definitely that crossing over to just deep compassion.
Yes.
I guess maybe that's a question. Yeah. I guess that's a question for everyone, is that would you encourage in terms of doing things, like really looking at how we can better train navigators?
Can I speak on the question before we move on real quick?
Yeah.
This goes similarly to Ms. Cantrell. I started in June in this position. I used to work in a couple OTPs as well as local AIDS project. And I am a native of our town, and I've had to access services myself. And one of the things that I think we've sort of discussed overall, but definitely having those. So I am in the health department, even though my office is not in the health department, but I am in the health department at least once a week on Friday afternoons, right next to syringe service. So we have a connection and a relationship there. So some of the people who will come on a regular basis, they also see me and become familiarized with me. And then those folks go out into the community and share the information. And I think that using the networks of the folks who are in need and empowering them to spread the word itself, I feel like is like a very huge thing, in addition to what has already been mentioned about as far as providers and understanding the benefits of MAT and things like that. But then of course, so I work a lot with uninsured people, and I'm very, very lucky that Buncombe County provides money for labs, for pre-treatment labs and things like that. And those are obviously significant barriers. My role really is trying to do my best to lower whatever those barriers are to getting the treatment. And we do get to offer transportation, which is a huge one. And then going back to you also, I'm very, very proud of our lack of no-show rate. It changed from 50% to like, I mean, we've had everybody show up pretty much since I started.
Nice.
I'm really, really proud of that. So that I also would go back to what you said as far as just lower risk activities, and also making sure people know that I care, as we say, that there are no requirements for any healthy time, any legal involvement. You can be currently or past use, things like being really upfront about, like, I'm always going to tell you the truth if I don't know the answer, just keeping it real genuine.
Yes.
Nice.
Just to add to that, sorry.
No.
And I think this is something that we've said without actually saying it, but just actually having services in one place. So getting at reducing almost one of the biggest barriers, which tends to be transportation and time, is if we can just as many services in one place as we can, I feel like we're going to have better outcomes. And that includes vaccinations for A and B as well.
Yes. We are fortunate enough, because we are a health department, we do have access to the vaccines too. So we'll do some labs on our harm reduction clients and go ahead and offer it to them regardless of whether they are in, our treatment, Hep C treatment programs. And then we're also really lucky we can offer PrEP here also. So we're kind of your one-stop shopping. Here in Virginia, we have Medicaid expansion, and also did away, we lobbied and fortunately achieved the requirement to work with a gastroenterologist or infectious disease specialist, as the lady previously was stating, has been removed here in Virginia. So
It's the same in Kentucky.
Yeah. Yeah, that's a huge barrier. It's that needs to go. That's first and foremost in those states. They need to work on getting that removed.
And most likely, we're most likely looking at the removal of prior authorization for Medicaid and for the preferred drugs.
That would be great.
Okay.
There's also a North Carolina is one of the only states remaining that has some of those for formerly incarcerated folks who have felony conviction not to be able to access food benefits and things like that.
Mm-hmm.
So there is hopefully it will be approved to start in the beginning of the year to expand that access. We don't have Medicaid expansion here, and just really, having reentry services, but even just being able to provide people with food at minimum. So that's one thing that I think we can work on too.
We partnered, we don't have a very large facility, but we did partner with some of our local churches, and they provide us with food bags. So we're blessed to be able to, most of the time, if some of our participants, if they need food, they know that they can come to us. We're not going to be able to supply them with a whole lot, but it's usually about 3 to 5 days worth of food. all shelf stable, unfortunately, so it's not the healthiest, but. And then we partnered with our Medical Reserve Corps. It worked a lot better pre-pandemic because there were more people traveling, but we asked all of them and then all of the health department people, we just simply asked that when you stayed in a motel, you saved all your soaps, your shampoos, and those types of things and brought them back to us. So we did, we usually will have hygiene kits for our participants too. And just them knowing, you know, that you care about them as a whole, you know, that they have clean clothes and they have food to eat and those types of things. It really does make a difference.
Michelle, Cameron, Mary Beth, Gabby, Jonathan, Aisha, any, we haven't heard from you. Do you have things that you think that we really should focus on to promote, enhance, and improve outcomes for PWIDs in context of harm reduction?
I would say, well, one, I'll just say it's great in Virginia, and Michelle, you said you're in Kentucky?
Yep.
It's awesome that you guys don't have to work with specialists in terms of hepatitis C treatment. I'm not 100% certain about Pennsylvania, but I think that's still a potential barrier in our state in terms of reimbursement for services and insurance. But I think one of the big things is, I was going to say from my state's perspective, you know, building relationships between SSP or MAT programs and medical providers that are able to get those services together. You know, I think a really great SSP program would have kind of a provider on staff if at all doable, but obviously we live in a world with a very little funding for things, right? So I would say any way to do your best to, you know, integrate, partner with, whatever, medical providers who are interested in delivering these services for that population. I'd say that's probably one of the biggest things. Yeah, also, again, from where I am in Pennsylvania, education on PrEP. I know this is a Hep C summit, but education on PrEP for PWID, I think is really important. I used to do many presentations at recovery locations, and the recovery community doesn't really seem to know about PrEP. And that's from, you know, staff members at places to the community themselves, right? So that's just—
Sorry, not to, yeah, I agree with you completely. Not to interrupt, because we're going to time out here. So I have as these, what we can do is policy, three things. One is prioritize policies to remove providing prescriber requirements and also prior authorizations. That would go a long way. Doctor said to me, yeah, the prescriber thing is for the patients, the prior authorizations for the doctors. So, so remove that PA process. We have a consensus on the one-stop shop, and that really aim to start really figuring out within communities how we can bring people together so that we can as barrier-free services as possible. And then for the last one, I think that even though this is HCV and not HIV, I would agree with the PrEP recommendations unless somebody disagrees, that really emphasizing prevention across the board is important.
And I'm not sure if you mentioned the peer navigation and peer advisory boards.
Oh, I love it. Yep, got it.
And because, you know, a lot of times people ask, well, you know, how do we increase engagement? And really the people with the lived experience are the ones that are going to best inform those.
Yep, I love it. I love it. All right. Well, anyone who wants to weigh in the last time? I so appreciate the conversation and the insight into your programs. They're amazing. Anyone? Going.
Just one idea for those who are still in need of infectious disease and gastroenterology consult, how we started here before that was removed. So we partnered with a teaching university and we did telemedicine. So that's just an idea for those of you who are kind of stuck.
And Gabby said she's apologized she doesn't have a working mic. We're sorry about that too, Gabby, because I'm sure you have incredible insight. All right. Well, Jonathan, did you have anything?
I just agreed with what everyone said, basically. I mean, there were a lot of really good ideas in here and everyone's doing a lot of great work. So I appreciate hearing from everyone else.
All right. Yeah, I really appreciate the peer navigation. I think that that's absolutely crucial. I think we always leave folks out of the conversation that should be to the center of the conversation.
It does take a team too.
Yeah.
I think it's super important. Like one of the things we've said is having kind of a representative of like all those different things, MD to PharmD to behavioral health to bridge counseling to referrals and immunizations and all those things. Just the communication is so important, like, which is why I'm really excited to be here.
Oh, nice. Great. So Gabby said that we here at True Care International Internal Medicine with Dr. Steinbach. Okay, Michelle, the breakout rooms are ending. Okay, let's go. See you back there.